Role transition self-reflection. My personal motivation to progress in this profession is gaining more respect from my fellow employees in my current job and showing my kids that it's never too late to improve your life. Always aspire to learn new things, and educating yourself is everything. There are challenges in any transition, but with nursing, I think it's going to be the mindset from one set of nursing to the other. Changing my whole outlook on something that has been day to day for the past 9 years will be very difficult, I feel. My personal characteristics used to overcome barriers is the willingness to learn new things and adapt quickly when given new information. My plan to have a successful program will be to study hard, really think about the whys, and going to work on my timing and scheduling to make sure there are no conflicts, allowing me to stay on track. That will probably be my biggest thing that I need to work on the most. So examples of being ready to transition from LPN to RN from my current work experience would be the desire to have more responsibility. When taking care of patients before and after surgery, I realized that I would like to be more hands-on in the recovery room and have noticed a change in the way I'm viewing patient care. I would also like to explore new responsibilities that are currently only given to RNs, such as leadership roles like team leader or unit manager. So all of these things are currently only held by RNs. So it's kind of a little bit of more of a motivation for me to want to transition now. Role blurring happens a lot in a hospital setting. So according to the New York State Office of Professions, LPNs are not allowed to assess a patient, but in the job that I have previously held as an LPN, we answered triage phone calls, and that in itself is an assessment of a patient. Charting is a way that can also be considered an assessment by having an RN or NP sign off on what you did after the fact. So this happens sometimes in like a clinic setting or on the floors, and I've recently realized that after doing the paper in class about role blurring. Some examples from my personal experiences that illustrate the differences in LPN and RN responsibilities are any job at the hospital, on a floor where policies of roles are strictly enforced. Some floors like the MICU or the TICU, there's a clear divide of responsibilities. Those are floors where they take your nursing titles and what you kind of do very seriously and go by the book to the T, especially when doing things like administering through central lines for RNs and doing bedside care for LPNs. So the resources that were used was the worksheet of role development and transition that we got in class, and I also used the website New York State Office of Professions.